This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 10th, and I'm Zach Caruso. Our lead story this week is from the Journal of Neuroscience and is titled Bitter Sensing Protects Drosophila from Developing Experience-Dependent Cocaine Consumption Preference. Cocaine use disorder, or CUD, is a highly heritable condition for which there are no effective treatments. Testing the many human genetic variants linked to CUD requires a cost-effective, genetically tractable model. This study showed that bitter-sensing neurons prevent cocaine self-administration in Drosophila. Disrupting Drosophila bitter perception enables a model for experience-dependent cocaine preference. The findings underscore the potential of Drosophila as a crucial tool for identifying the genetic mechanisms underlying CUD, aiding in the discovery of new therapeutic targets and contributing to the development of effective treatments for this highly heritable disease. A new article in Drug and Alcohol Dependence is titled Benefits of Acute Aerobic Exercise to Ameliorate Craving and Risky Decision-Making in Individuals with Methamphetamine Use Disorder. Male subjects undergoing rehabilitation for methamphetamine use disorder, or MUD, at a facility in China had craving and decision-making measured shortly after 20 minutes of moderate-intensity aerobic exercise and, in a separate session, after 20 minutes of rest. A session of moderate-intensity aerobic exercise significantly reduced craving. The aerobic exercise also improved both risky decision-making and myopic decision-making. However, aerobic exercise did not improve a measure of risk-taking behavior. Authors suggest moderate-intensity aerobic exercise may reduce the risk of relapse in MUD. Next is an article in JAMA Network Open titled Cannabis Use Among Older Adults. Authors conducted a cross-sectional study of a VHA cohort of patients aged 65 to 84 to assess cannabis use and cannabis use disorder, or CUD, and potential associated factors. Overall, 58% of veterans reported ever using cannabis, with 10% reporting past 30-day use. Among those who reported ever using cannabis, 28% reported they used it for a medical reason, most commonly pain. Factors associated with past 30-day use included age 65 to 75, tobacco use, other substance use, financial hardship, and living in a state where recreational use was legal. Among those with past 30-day use, 36% met criteria for CUD and were more likely to be younger than 76, have anxiety, and deficits in activity of daily living. Given the relatively high rates of cannabis use and CUD, authors support screening for older veterans. Next is a study in drug and alcohol dependence titled Carcinogen Reduction in a Randomized Controlled Study Comparing E-cigarette Provision to Assessment Only Among People with Serious Mental Illness Who Smoke. People with serious mental illness, or SMI, have high smoking rates and low quit rates. Participants with SMI with no current desire to quit were randomized to receive either electronic nicotine delivery system, or ENDS, or a control. The ENDS group was asked to replace their cigarette use with ENDS. The ENDS group reduced their cigarette use by 59% and exhaled carbon monoxide by 36% compared to 6% and 9% for controls. NNAL, a metabolite of the tobacco-specific carcinogen nitrosamine, was significantly lower at 4 weeks compared to control, but the effect diminished at 8 weeks. Reductions in exhaled carbon monoxide strongly correlated with reductions in NNAL. Authors conclude that ENDS provided short-term harm reduction, but behavioral support may help sustain the benefit. Our next article is in JAMA Network Open and is titled Initiating Injectable Buprenorphine in People Hospitalized with Infections. This randomized clinical trial of 171 adults with infections and OUD assessed if initiating long-acting buprenorphine with infectious disease management, or ID lab, for hospitalized persons with OUD and infection improved receipt of MOUD 12 weeks after randomization. It found that there was no difference in the proportion who received MOUD at 12 weeks between the ID lab and treatment as usual arms. These findings suggest that patient preference and shared decision-making should guide which formulation of MOUD is started during hospitalization for infections in patients with OUD. Next is a study in the Journal of Addiction Medicine and is titled Pharmacokinetics of Oral and Extended-Release Naltrexone in Pregnant and Lactating Individuals and Their Infants. Naltrexone may be an option for treatment of OUD and AUD during pregnancy, but little is known about its pharmacokinetics. In this study, authors assessed oral and extended release, or XR, naltrexone levels at multiple time points during pregnancy, at delivery in mother and infant, and 1 month post-delivery in breast milk and infant. Naltrexone was identified across dosing intervals for both oral and XR formulations during pregnancy, but levels were low at the end of XR formulation dosing period. Naltrexone was also detectable in infant post-delivery consistent with transplacental transfer and in breast milk 28 days postpartum with low levels detected in the breastfeeding infant. These findings do suggest dosing intervals for XR naltrexone may need to be increased to maintain therapeutic levels during pregnancy. Our next article is in Proceedings of the National Academies of Sciences and is titled Individuals with Substance Use Disorders Experience an Increased Urge to Move to Complex Music. Substance use disorders disrupt the brain's dopamine system, which is key to movement, reward, and music perception, specifically the pleasurable urge to move to music, called groove. This study examined how long-term cocaine and heroin use, which lowers dopamine levels, affects the experience of groove. It found that drug users preferred music with high rhythmic and harmonic complexity more than non-users, while responses to moderate complexity were similar. This pattern is different from other dopamine-related conditions like Parkinson's disease. The results suggest that drug users need more intense, complex stimuli to activate their reward system, supporting the idea that reduced dopamine raises the threshold for non-drug rewards. Our final article is in the Journal of Adolescent Health and is titled Time-Specific Predictors of E-Cigarette and Cigarette Use Trajectory Classes from Pre-Adolescence to Late Adolescence, 2013 to 2020, of the Population Assessment of Tobacco and Health Study. In this study, authors evaluated e-cigarette and cigarette use in adolescents across 7 years of the Population Assessment of Tobacco and Health, or PATH study, to assess changes in use patterns and predictors of those changes. The authors assessed patterns of use over time, identifying 5 classes of e-cigarette use and 4 classes of cigarette use. Authors identified daily social media use and advertising exposure were associated with susceptible and initiation of e-cigarettes in young adolescents. In addition, friends that used, a low perception of harm, and other substance use were all associated with trajectories of both e-cigarette and cigarette use. Authors suggest these factors should be addressed in targeted intervention and prevention strategies, including regulation limiting advertisement. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.